Welcome. We're happy to have you with us today as we introduce Mind Over Matter, Healthy Bowels, Healthy Bladder, a new high-level evidence-based program that addresses the issue of older women's urinary and bowel incontinence. Our presenters today will be Dr. Heidi Brown from the UW School of Medicine and Public Health, Shannon Myers, the faculty trainer with the Wisconsin Institute for Healthy Aging for this program, and myself, Betsy Abramson, also with the Wisconsin Institute for Healthy Aging. Let's get started. First, a little bit about WIHA. We are a nonprofit clearinghouse of evidence-based prevention programs here in Wisconsin. Although several of our programs we do license across the country, like Stepping On, the Falls Prevention Program, and now Mind Over Matter, Healthy Bowels, Healthy Bladder. Our mission is to bring these evidence-based programs to communities throughout Wisconsin and the nation, and to encourage healthy living and healthy aging. WIHA has two functions. Our primary function is dissemination for proven evidence-based health promotion programs, whether those came from other universities or whether they were created right here in Wisconsin at the University of Wisconsin. And our secondary function is our research arm. That's our community academic aging research network that develops new evidence-based prevention programs through partnerships and community-based participatory research between researchers and communities. We develop, test, and prove new programs, and Mind Over Matter is an example of that. Hence, our tagline is from research to practice to people. The research that happens over at our University of Wisconsin or in other communities, that we then take those well-researched programs, convert them, translate them into being disseminatable, if that's a word, to do all the surround and support needed for those so that we can then get them out to people, to actual folks who to help improve their efforts in healthy aging. Some of you may be familiar with a version of this chart. I've seen it in various variations. It was created actually by the University of Wisconsin School of Medicine, our Population Health Institute, that, not counting genetics, looks at the other determinants of health and what are the factors that actually impact health. Most of you are probably familiar with this gold big wedge, the social and economic factors, and the gray 10% physical environment, which we often think of as the social determinants of health. What often surprises people is that clinical care is only 20%, the clinical care access and quality. And actually what's bigger is the space that we live in, which is these health behaviors. 30% of your health is impacted by what you do yourself. Exercise, nutrition, stress management, following what those clinical care guidelines were, taking your medication appropriately, and engaging in other healthy behaviors or not. And that blue light space is the lane that we live in. So we work upstream in the shallow end of the pool, where we find that it's cheaper. Obviously, healthcare interventions at the cheaper end of the pool rather than the deep one. Obviously, if you had to pull somebody out of the pool, you'd rather have to, in the middle of a tornado, you'd rather be pulling out one of those ladies in the shallow end than trying to get somebody in the deep end. And that's what our goal is too. So what is an evidence-based prevention program? Probably many of you listening are quite familiar with this. We use the definition that is used by the Administration for Community Living. And without my reading those all to you, you can see that essentially it means something that's researched and proven. And these are the 5 elements that it requires for a program to meet the these high-level criteria and be dubbed a high-level evidence-based program by the Administration for Community Living. Improving the health and well-being, the type of research that was done that is published in the peer-reviewed journal, translated and ready to be fully disseminated. And that's where Mind Over Matter is. It was approved in 2020 by the Administration for Community Living and now is ready for full dissemination. And for those who follow the Administration for Community Living's guidelines in selecting their programs, you know if you implement Mind Over Matter that you're using a program that does indeed meet those criteria. For WIHA, as a statewide support center, technical assistance, training center, and clearinghouse, we provide a range of support for our leaders and program provider organizations. And you can see those listed on this slide and the next one that I'm going to click to in a second. Leader applications and leader training. We make sure that we have a path for organizations that purchase licenses from us to run our nationally licensed programs, a path for them to develop their own master trainers. We create the leader manuals and toolkits and the master trainer manuals and toolkits. We help you determine a good system for fidelity coaching, and we create implementation guides. And we also create materials to help you market your programs, both to market to potential program provider organizations, as well as to potential participants. We host webinars and have refreshers on the programs and listservs for all leaders and licensees. We try to develop conference calls once a quarter or so for all licensees to be able to meet with other licensees and exchange both successes and challenges. A couple of our programs we're translating to other languages and cultures, and we recommend different data collection systems for you to both provide program maintenance and improve it, as well as to evaluate the outcomes of the programs. So since 2011, when WIHA started, we've seen a significant growth in our programs. They're all listed there. And for those of you out there who are also providers of evidence-based health promotion programs, you'll probably see many that are on your list as well. The two that are in blue, number 2 and number 11, are the two programs that we license nationally. And again, today we're focused on number 11, Mind Over Matter, Healthy Bowels, Healthy Bladder. And just as a little teaser of what's coming next, is we're in the process of getting ready to be able to disseminate a sedentary behavior reduction program called Stand Up and Move More. And we're also translating Stepping On, our falls prevention program, into Spanish, which will be called, and excuse my accent here, Pisando Fuerte. Here's our website, withhealthyaging.org. We invite you to visit it and to bookmark it so you can learn more about our different programs. And if you look up across the top and you click on the programs, you'll see a drop-down menu there that lists all of our programs, and we'll share lots more about Mind Over Matter as well as the other programs that we have operates. This slide shows you who our partnerships are, the types of agencies that whom we partner with to accomplish our mission of going from research to practice to people. Pretty self-explanatory here. Of course, we work with academic researchers, both in our Community Academic Aging Research Network, who help us research new programs and develop new programs, as well as evaluating those that come from other agencies as we determine whether they're a good fit for our structure here at the Wisconsin Institute for Healthy Aging. We, of course, work with state public health and state aging departments who develop the policy around the state. We work with lots of community organizations, and their types are listed for you there in the orange column. These are organizations that both serve as program provider organizations who identify individuals to become trained and lead or facilitate some of our programs, to identify potential participants whom they refer to us, as well as some that are simply host sites for our programs. And finally, the same with the healthcare and related organizations. They are program provider organizations. They assign staff to or volunteers to be leaders for our programs. They refer participants, and they offer us sites to hold the programs as well. And with that, I'm now going to turn the PowerPoint over to Dr. Heidi Wendell Brown, who will give you more background specifically about the issue of urinary and bowel incontinence in older women and how the Mind Over Matter program was developed and its excellent outcomes. So here we go. Take it away, Dr. Brown.
Hello, I'm excited to speak with you about Mind Over Matter, Healthy Bowels, Healthy Bladder. My name is Dr. Heidi Brown, and I'm a urogynecologist and researcher at the University of Wisconsin-Madison. That urogynecology is a subspecialty field within OBGYN. And I'm a doctor. I see patients in clinic, I do operations, And my research focuses on how to bring solutions for the conditions I treat to women outside healthcare settings. My goals in today's presentation are to share information with you about a new continence program we developed and to inspire you to consider bringing this program to your community. When you think about women's health, you might think about an issue like breast cancer, incredibly common and often talked about. 1 in 8 women in the United States will develop breast cancer in her lifetime. What you may not realize is that by menopause, half of us will develop urinary leakage, and 1 in 5 women has bowel leakage. And this is because of the many common conditions that can increase our risk for bowel leakage, such as disorders of chronic bowel disturbance, diabetes, obesity, having babies. While we don't talk about it much, incontinence has an impact on our daily lives. And this is a quote from a participant in some of my earlier research describing what the experience is. Some people will say, I don't travel anymore. They don't say why, but they don't dare go out anywhere, out to eat, out to a band concert, or whatever. They don't dare go out because. And while we think about it often as a quality of life condition, incontinence can actually be dangerous because women with incontinence are at increased risk for falls, hospitalization, nursing home placement, social isolation, and depression. Unfortunately, most women with incontinence don't talk to a healthcare provider about it. Fewer than 30% of women with bowel leakage and fewer than 50% of women with bladder leakage have ever spoken to a doctor about it. And most doctors don't ask patients about it. We did a survey of primary care providers at our own University of Wisconsin, and we found that fewer than a third of doctors screened most patients for bladder incontinence, and fewer than 10% screened most patients for bowel incontinence. And that's mostly because doctors don't feel informed to treat incontinence. Only 27% of doctors said that they felt very or extremely informed to treat bladder incontinence, and fewer than 5% felt very or extremely informed to treat bowel incontinence. And that's really a shame because behavior changes can cure mild bladder and bowel leakage. And when we say behavior changes, we're talking about things like strengthening and coordinating the bowl of muscles that support the openings of the bladder, vagina, and rectum, called pelvic floor muscle exercises or Kegels. Making changes to how we eat and drink, changing our fluid and fiber intake, and improving the way that our brain communicates with our bladder and pelvic floor muscles. When behavioral changes aren't enough, many other solutions exist too. There are specially trained physical therapists who can help us work to strengthen and coordinate our pelvic floor muscles. We can do outpatient nerve stimulation right in the office. We can use devices that sit inside the vagina to support the openings of the bladder or rectum. We can take medicine and we can do surgery. So, how does Mind Over Matter fit in? Mind Over Matter Healthy Bowels, Healthy Bladder is a small group education program led by a community member. It helps women build skills and confidence to change their behaviors to improve their health, support and learn from one another, and find professional help if they need it, so that when they try to bring it up with the doctor, even if the doctor doesn't know how to help someone, the tools that the patient has learned from Mind Over Matter help her get to somebody like me who can help. We developed Mind Over Matter Healthy Bowels, Healthy Bladder as a partnership between community organizations and the university through something called the Community Academic Aging Research Network. The idea behind this is that from the beginning of developing the program, we combined the people who would be offering the program, community organizations like you, and the organization that would be disseminating the program, the Wisconsin Institute for Healthy Aging, so that as we developed and tested the program and then packaged it for broader delivery and eventual distribution, we made sure that the program that we were testing was something that was doable for the community organizations. So, Mind Over Matter Healthy Bowels, Healthy Bladder, or MOM, is an incontinence prevention and treatment program that builds confidence and skills to plan for, change, and maintain healthy behaviors. It's for a small group of 8 to 12 women, led by a trained female facilitator from the community. Importantly, that person doesn't need to have any healthcare experience. The whole program is only 3 classes, each of which is about 2 hours with a snack break included, and the classes are held every other week for 1 month. The goals of MOM are to dispel myths and promote awareness, deliver information about evidence based behavior changes to improve continence, encourage active learning through multiple formats, and build self efficacy or self confidence for behavior change. The activities and information in the program are built on a scientific model of behavior change where we move from before even thinking about making a change to thinking about making a change, planning to make a change, and then making a change and continuing to sustain that change. And the activities in the program are based on this scientific model of how we move along that continuum from thinking about doing something to actually doing it. In a mom workshop, women learn how our bladder, bowels, and pelvic floor muscles work together. They learn how to do pelvic floor muscle exercises, how to adjust fluid and fiber intake to improve symptoms, how to set and achieve reasonable goals, how to solve problems and cope with setbacks as a group, and how to overcome challenges if we decide to seek health care. So, how do we know that the program works? Well, we did something called a randomized controlled trial. So we recruited women who were at least 50 years old and had incontinence, either bladder incontinence, bowel incontinence, or both. And they had to be willing to not start a new therapy for incontinence during the time that they were in the study. And everybody who was assigned randomly to either the treatment group or the control group completed surveys at the beginning, 1 month later, and 4 months later. Women in the treatment group took the mom workshop right after they provided their baseline survey data. Women in the control group completed all the surveys and then they got to do the mom workshop. And then we could compare how women in the treatment and control groups did to see how well the workshop worked. We had a total of 121 women who participated in the trial, and they were probably similar to the women that your organization serves. Their average age was 74 years old. They were overweight to obese based on their average body mass index. They were mostly white and retired. Most had both bladder and bowel incontinence. 40% had bladder incontinence alone, and 10% had bowel incontinence alone. And the women in the treatment group had a 9-fold improvement in their bladder symptoms and a 4-fold improvement in their bowel symptoms compared to women in the control group. So, what does that mean? The next 2 slides, green means symptoms got better, yellow means no change, and red means symptoms got worse. Women in the treatment group asked about their bladder symptoms 3 months after the workshop. 71% of women in the treatment group versus 23% of women in the control group reported that their urinary leakage was better or much better. Importantly, while only 5% of women in the treatment group had worse bladder symptoms, almost 20% of women in the control group had worse symptoms. We saw similar trends with bowel leakage. 55% of women in the treatment group and 27% of women in the control group had improvement in bowel symptoms 3 months after completing the workshop. And importantly, even fewer women in the treatment group worsened over that time frame. And here are some of the statements from women who've completed the mom class. It was nice to know that I was not the only one having leakage problems. I can now take the 40 steps to the bathroom at night without any leakage. I will continue to do the exercises. The exercises have helped me so much that I no longer need to wear a panty liner. I used to wake up 2 times a night to pee. Last night I got through the whole night without getting up. And my personal favorite, thank you for the classes. They have made life worth living again. Right now, you might be thinking, I still don't know about this, which was the reaction of Jill McCone, the director of the first senior center that ever let us do a pilot workshop. We were concerned. We wondered if anybody would come if we advertised something as bladder and bowel workshop. But if you give it a try, I think what you'll find is, wow, people really love this program. The first time we offered it at the Fitchburg Senior Center, we had standing room only. We ran out of handouts. Um, and importantly, that became sort of the driving force behind us trying to make this program doable for community agencies because we saw how many women who might not be going to their doctor would come to a community organization to learn about bowel and bladder health, especially if it was advertised as prevention or treatment. Not to mention, I think you'll also find, wow, this program is so easy, like it was designed for us, because it was. In conclusion, incontinence is common, significant, and treatable. You can help women in your community improve or prevent symptoms without medicine or surgery through offering the Mind Over Matter Healthy Bowels, Healthy Bladder program. This program was specifically designed by and for community organizations for optimal ease of implementation. You don't need any healthcare background. It's only 3 classes. You don't need any additional special props. So I hope you'll consider trying it in 2021. Now I'm going to turn it over to Shannon, who's going to tell you more about how to bring this program to your community. Thank you very much for your attention.
I'd like to share a little bit of a thank you to Dr. Brown and sharing more about the Mind Over Matter program, where we've gone from the history to the development, what we've learned through the pilots, the randomized control trials, and then finally bringing it to dissemination. Currently, right now, I know this is just a snapshot of Wisconsin, but currently we have about 37 trained facilitators in Mind Over Matter. And we've worked through about 63 different workshops since 2019. 11 of those are projected to be scheduled and or completed online. And then the number of participants that we've reached, women participants, is about 315. And of those, we consider completers to have completed 3 or more sessions. However, we know that life does happen, and so we'd like to share just a little bit about how many had shown up for 2 sessions and 3 sessions. So you can see that 286 had attended 2 sessions, and then of those 286, 204 had attended all 3 sessions. A little bit about our provider breakdown in terms of where the program was disseminated and brought into the communities. You can see that a lot of the aging and disability resource centers and aging units, or in some other areas, it might be more of the area agency on agings. We also engaged with healthcare systems and having it at the facilities. Otherwise, other healthcare or community-based organizations, public health departments, and then finally the senior centers. To help better understand if your community is ready to engage with a Mind Over Matter workshop and making sure that it's right, we have a nice little tool on our website at www.wihealthyaging.org. We have a tool that will kind of take you through all of the different components of Mind Over Matter and all the supports, all the stakeholders, anybody that you need to engage on your team to really be successful in your rollout. And this will kind of take you through those different checkpoints and really think about all of the different little details that bringing a new program to your community really encompasses. So looking at the little finer details of that planning guide, here are some of the things that you really want to focus on. First and foremost is identifying a coordinating agency or organization that can really reach the community members. Second, potential license holders will need to identify 2 women facilitators for the start of the license. Because the program only does require 1, if that 1 facilitator gets trained and then leaves or falls ill, unfortunately it usually ends up kind of being done at that point. So we really want to set up future license holders to be successful in the rollout of their MOM program. Also looking at dates and times for their first workshop. So when they attend the training, we want to make sure that they're already focusing on what dates and times their first workshop will engage and whether it's going to be online or in person. And of course, if it's in person, to thinking about who or where, what's the room arrangement, what are some of the equipment pieces that you may need. Just really thinking through those details so then that way when that facilitator returns from training, you have a plan in place. And then also an understanding as to whether or not the workshop is going to be free or if it will have a fee associated with it. And then finally, what agency will submit a workshop notification and to whom. So if you're outside of Wisconsin, the license holder will have to determine how they're going to collect those workshop notification forms or notifications. We do have examples at the Wisconsin Institute for Healthy Aging that we can share upon request. And then also identifying a point person as to kind of who is keeping all of that data. And then the last part on this slide here is what agency will receive the workshop workshop registrations. Is it going to be the organization that's putting on the program? Will it be a hub? So really thinking about who is registering those participants for the workshops. As I mentioned in a previous slide that the organization or the license holder will have to identify 2 women facilitators to start their license. So to identify a proper facilitator, again, it does have to be a woman. We are currently working towards a men's version, but right now we know that it's valuable to have the same gender in that facilitator role. So that facilitator, that woman facilitator, should have experience in delivering evidence-based programming, evidence leading groups of older adults, the ability to demonstrate exercises, modify, and advance. The MOM program uses Kegel exercises, and so the woman facilitator will have to be comfortable in how to deliver, explain, give some kind of tips on how to do it correctly, as well as how to advance them correctly. Also, they have to commit to facilitating 2 workshops per year. Just as a reminder, the program is only 3 sessions, 2 hours each, and it happens every other week. And when you pair that up to a more traditional type of health promotion program, that it's about the same amount of time as if you were to do one 6-week program. Also, we want the facilitator to be comfortable with public speaking and being very clear in their communication skills. We do talk a lot about the woman's anatomy as well as pee and poop, and so we want to make sure that those women facilitators are feeling comfortable as well as feeling or showing empathy and compassion, as we know that it's a very sensitive topic for women to come forward and talk about. We also want to make sure that they have good organizational skills and then interest in working with older adults. And then finally, having comfort discussing bladder and bowel function. To continue on with the facilitator expectations, we want the facilitators to attend an entire 2 full-day facilitator training. This will be either offered online or in person. As I mentioned previously, that they have to commit to 2 workshops each year. They also have to follow the program manual to ensure consistent delivery and program fidelity. We want to make sure that the participants are getting the benefit of the program that was designed. And then to register workshops, again, that will be determined by the local license holder if you're outside of Wisconsin. And then copy and distribute the participant manual. The participant manual is a very slim manual that you would print off. It's about 80 pages front. You can print front and back, and it encompasses all sessions handouts. And then also follow other Wisconsin Institute for Healthy Aging's administrative protocols that are defined within the license contract or that are shared within the training itself. During the 2-day facilitator training, the facilitators must attend both full days. And what will be learned during that time, they'll be learning the supporting evidence that Dr. Brown had shared during our webinar today, as well as the underpinning concepts of what makes Mind Over Matter, Healthy Bowels, Healthy Bladder successful, how to facilitate through the Mind Over Matter curriculum, group facilitation and managing challenge personalities, especially with this being a sensitive topic. We want to make sure that we're keeping the environment a positive and supportive one. And then finally, we talk about different marketing and recruitment tactics. We know that MOM does offer some unique strategies to market, and those will be shared during the training. And then beyond those points is the expectations within the facilitator training is that there are 2 practice facilitations that the facilitator will have to engage with. They also have to pass an essential element quiz, which is a true, false, or multiple choice. And then finally, as the final component, is have a fidelity coaching session during their first workshop series. We also want the facilitators to learn the Wisconsin Institute for Healthy Aging's protocols for the workshop notification and data collection, especially if they're in Wisconsin, but also this is something that we can share with those that are outside of Wisconsin obtaining a license on how to collect those bits of information. In the course of the training, we do cover as to what is all needed in workshop planning. And so we do have a tool that's under the password protected site for facilitators. So once a individual gets trained, they will gain access. And this is one of the many tools that will help them learn and organize their first workshop and ongoing workshops. It's a way to lay out who's doing what, where the program is, what are the dates, who's taking registrations, and so forth. So in times like these, during the COVID time, we are currently offering the program online. As I'd mentioned, we have about 11 that are either scheduled to move forward or have already been done in Wisconsin, and most likely will be tested effectiveness in the near future. We're also helping the facilitators in the training to work towards a parallel experience. So whether the program is delivered in person or online, that the experience that the participants will be receiving are very close. The only thing that is really removed is being in person. But otherwise, most activities are very much the same, whether it's done in person or online. Some of the challenges that we've come across, of course, with any other program that you might be engaging with is just the access to internet and technology, as well in some cases the bandwidth of what a participant may or may not have at that particular moment. Some of the successes that we have is we do online orientations with leaders to make sure, or leaders and facilitators to make sure that they're ready and that they feel comfortable delivering an online program. For Mind Over Matter, we also ask that a technology person or technology support person joins the program as well. We do ask that it to be a woman as well. And we do have some ground zero classes. Mind Over Matter, Healthy Bowels, Healthy Bladder does have a ground zero class that will take you through all the different components that are utilized throughout the workshop. And for the facilitator to kind of work through with the participants so they are ready for session 1. And then finally, that through the trainings that we've had is that the delivery does mirror the in-person delivery when done online.
Thank you, Dr. Brown and Shannon. I'll close out our session now by talking a little bit about the training options and license structures for Mind Over Matter. And these 2 issues, of course, go hand in hand. License holders are accountable for properly trained facilitators, and the facilitators practice collaboratively under the license of each license holder. Our license structure, you will discover, encourages increasing workshops and adding facilitators so that you can reach more older women. Some of the evidence-based health promotion programs have limits on how many leader trainings you can have a year, or how many workshops, or how many leaders are covered. And we have chosen not to go that route because we want you to be able to get your license and grow, so that we can get these important program out to as many people as possible. So let me describe a little bit more to you in the upcoming slides. Our facilitator trainings right now, going into 2021, are certainly going to be starting out online. We have one scheduled for April 22nd and 23rd. And when you go onto our website, you will see where the leader trainings are from the home page. If you scroll all the way down to the bottom, you'll see the leader training schedule there. Of course, we call them facilitators in Mind Over Matter. And then in June, we're planning, fingers crossed, that we'll be able to do this one in person. If COVID is still raging or still a problem, then we'll convert that one to online as well. So that would be either of those are for prospective license holders to send individuals, whether you send them through cyberspace or send them in person, to either the April or to the June facilitator training. A third option, in addition to the April and June, is for us to come either on site, come to you on site through cyberspace or on site physically, once that's safe to do so, where you would contract with us for us to send 2 of our master trainers to your own community, because you might have anywhere from 8, 10, 12, up to as many as 20 potential facilitators from your agency or your organization and your affiliates. And we would then train all of those folks in one facilitator training over a 2-day period. Once you have it up to once you have at least 2 individuals who have been trained, have conducted 2 workshops, and for whom we have been able to provide a fidelity review and found positive fidelity, those 2 individuals may then apply to become a master trainer, which we do the master training then online in a less than a half a day webinar, and then you're able to move on and to provide your own facilitator trainings. We have 2 types of license holders. One is a sole license holder. That's a person who has their own trained facilitators and employees or volunteers from their own single organization, their own health system, their own area agency on aging, their own retirement community, their own hospital, etc. And all of the trained facilitators are employees or volunteers with that sole organization. A second type of license holder is a license holder that has affiliates. Affiliates are separate, and look at those 4 criteria. They're a separate public or private organization or agency or AAA or a separate entity in your same state. That organization, that affiliate organization, will also be presenting mom workshops under the license holder's license. Third, that organization has trained facilitators. And fourth, the license holder agrees to be responsible for fidelity and annual reports from that organization. So for example, that license holder might be your state unit on aging, or a consortium of area agencies on aging, or your state Department of Health, and then has affiliates as being a group of, let's say it's your Department of Health, might have as affiliates several area agencies on aging, a health system, a senior center organization, whatever. And those affiliate organizations are then also presenting mom under that state unit on health license. And those affiliates have their own facilitators, 1 or more facilitators under in their affiliate organization. But it's that license holder, that state unit on health in my example, that commits to being responsible for fidelity of all of the affiliates, facilitators, and agrees to provide the reporting and of course the payment of the license fee. The all-important question, what does it cost? Here are the fees for 2021. For the online facilitator training, it's $450 per person. And you'll see that when you look at our leader training schedule too. For the online master training, which again, you would be 2 people would need to be available, interested, and eligible and supported by their home organization in doing that. And that's $750 a person for that half-day webinar and all the materials and the master trainer manual and all, for them to be able to then in pairs, those 2 master trainers, to be able to then go on and train more facilitators within your own structure. The cost of the sole license is $3,000 for 3 years. and that's guaranteed for 2021. And then we have affiliate tiers. 1 to 4 affiliates, for example, cost $5,000, again for 3 years. And what we find is that generally when affiliates are involved, license holders may ask each affiliate to pay a share of the license fee. So if, for example, the license holder had 4 affiliates, might ask each of the affiliates to put in $1,000, or which is actually only $333 a year, and the license holder might put in $1,000 itself. But anyway, how a license holder and their affiliates agree to have that done is up to you, whether the sole license holder is going to pay the fee itself or whether they want to charge or ask for contributions from their affiliates. But those are the fees. Sole license, $3,000. Affiliate tiers, the first tier that goes up to 4 affiliates is $5,000. The next tier, which I believe goes up to 8 affiliates, is $8,000, and we go from there. So happy to talk to you individually about this. And finally, some of you may be considering applying for the new chronic disease self-management education grants that were just announced by the Administration for Community Living and are due on February 2nd. Or perhaps you're looking to submit a grant proposal to some other organization or foundation or government agency or city or county or state budget. If you need a letter of cooperation from WIHA about being able to become a license holder and secure training from us, would we offer a letter of cooperation for you? The answer is an unequivocal yes. If you want to become a new licensee and need a letter of cooperation about your plans, please contact us. Send us details of your proposal, the choice of plan that you're thinking of for facilitator training. Are you thinking of the April online training, the June in-person training in Wisconsin that may go forward in person or may go online? Or are you thinking of asking us to come to your state, either online or in person, to provide that facilitator training? Are you thinking about being a sole license holder, or are you thinking about having affiliates? Do you have any plans down the road for developing master trainers so that you'd then be able to go forward on your own in developing new facilitators? We'll review that, give you a call or an email if we need any more information, and then we'll prepare a letter of cooperation for you. We'd like to have at least a couple of days, ideally a week, to prepare that and get that going for you, but we'd be very happy and interested to do that because, as we mentioned, we went through all this because we want to get this program out there, partner with you, and see it grow and get to more individuals. So we thank you for your time today. There's the contact information for both Ms. Shannon Myers and myself, and we welcome emails or phone calls to discuss this more, how we can help you, ideas that we didn't, or issues that we didn't cover in here, or things you may have more questions about. Check out the website, the WIHhealthyaging.org website under Mind Over Matter, and or just give us a call straight away, and we look forward to talking to you. Thanks so much for your time today. Good luck to you, and we hope that Mind Over Matter will be an appealing program that you want to add to your offerings and evidence-based health promotion programs. We know it works very well, is very much welcomed and appreciated, and has fantastic outcomes. So let's grow together. Thank you.